It's 3 weeks since I had my eyelids done. I filmed it from just afterward all the way up until today because I wanted to show you exactly what happens, exactly how your eyes react, exactly what you feel and how they heal. And nobody shows that, so I don't mind showing you. And if you're thinking about doing it, now you know exactly what to expect. Upper eyelid blepharoplasty. Upper blepharoplasty is the removal of excess skin and tissue in the upper eyelid. Okay, I did my upper eyelid surgery this morning. It was easy breezy. Still have my little bracelet on from the surgery center. I'm back home. Okay, before I go any further here, I need to show you what my eyelids looked like before I did this. The skin had gotten very thin and was kind of folded over on itself, and there was some excess tissue there. The lids would get puffy every now and then, depending on the time of day, and there really wasn't anything I could do about this issue. I mean, all the diet and exercise in the world weren't going to help this. I noticed that I started wearing sunglasses a lot whenever I could because I wanted to cover my eyes. That's like the old rock star trick. So I had kind of run out of options on what to do about my eyes. So I decided that surgery was necessary, and I know an excellent surgeon. So I consulted with him and I went ahead and booked it. So this is right after I did the lid lift, same morning. I guess the surgery itself was maybe 40 minutes. There was no pain, and all I've taken since I left is one Tylenol. There's no bandages, and he drew on my eyelids for quite a while, like 15-20 minutes, making a lot of little markings. Up close here so you can see the suture line in the eyes. It's right in the crease of the eyes. You really can't see it when your eyes are open. I mean, it's not that bad. You can see some of that if you look up close. It's kind of red, but that's not really a big problem. Already I can see I have eyelids now where I did not have eyelids before. The skin was just all the way flapped over and down to the lash line. So it's already much better. I'm home. I feel fine. It's not general anesthesia. Just I think they used propofol. Propofol? The Michael Jackson drug, which in the right hands is a wonderful drug. So I wasn't awake. You know, I felt like I was asleep, but there was no tubes down my throat or anything like that. It was all done with IV, and supposedly you feel fine afterwards, and I do, so that's good. This is later the day of the surgery, so I was presentable. Okay, this is day 2. My eyelids are really red, and I'm not allowed to put any makeup on them because they don't want to get the sutures infected. So I can't even put concealer on. I don't know why they're red. So I have to go out like this, but fortunately, I wear my sunglasses. I already went out and got a manicure. I really can't complain at all, and since this is elective cosmetic surgery, what kind of a jerk would I have to be to complain anyway? But they're just red. Looks like red eyeshadow. Day 3. Okay, when I woke up this morning on day 3, my eyes were the worst so far. They were really puffy, and they were kind of watering a lot. No pain. There's no burning or itching or anything like that. They're just swollen. But I've been putting ice on them, so, cold compresses, so that helps. I'll show you. See if you can see that up close. Last night I was able to put the antibiotic ointment on the sutures, and that felt good because my lids felt really dry, and I wasn't allowed to put any lotion or anything on it. But other than that, it's not painful. But thank God for sunglasses. Okay, it's day 4, and I felt well enough last night to spend the evening in a hotel down in Coral Gables and to visit with some family that was down here. The skyline of Miami is over there. There it is. I'll show you up close. Take off my glasses and freak you out. See all the sutures? The bridge of my nose looks kind of wide because it's swollen. Like I said, I got that avatar thing going on there where the bridge of my nose is a little bit swollen. Put my sunglasses on and I will go out and enjoy Miami. And nighttime in Miami is no problem. It's dark in these bars and restaurants. And nobody's looking at my eyes. They're looking at things like this wine girl swinging around here. So it's very easy to go out and nobody's looking at the eyes. So I'm having a good time. This is 5 days after the surgery. Still no pain or anything like that, and they're getting better. Still can't put any makeup on, but they're not bothering me at all. They're not, they feel a little tight, but that's about it. Tight is good. Tight is better than loose. Day 6. Okay, this is day 6, and I'm going to take off my sunglasses here in a minute. You'll see that my upper lids look a lot better, but there is that red under my right eye. Looks like I have a black eye or something. There's no pain or anything, no discomfort. The swelling's not even so bad. It's worse in the morning. I don't think I sleep on my back propped up all night, although I start out that way. I'm supposed to, but I tend to sleep on my face, and I think at some points during the night I do go face down. It hasn't really curtailed my activity other than there is a luncheon that I would have gone to, and I decided not to because I don't want to put any makeup on my face and ruin this, and I figure if I'm sitting across the table from somebody, it might be kind of nauseating, they might not be able to eat. It's day 7 and I still have some swelling. Day 7, I feel pretty much back to normal, other than my eyelids being a little tight. Day 8. This is day 8. I had this done 1 week ago today, and I don't really even need to wear sunglasses anymore. Unless you look real closely and can see the sutures, which I'll get up close so that you can, you wouldn't really notice. So I have nothing to complain about, but like I said before, I'm not going to go get a cosmetic procedure and then complain. This is my choice. This is my idea. Day 9. My sutures came out today. Most of them. I still have a few on the outer side. I'll show you. Take off my glasses. But you see there's just the sutures along the outer edge are still there, but all the ones along the middle, center and middle of the lids are gone. Here we are, day 10. I love looking in the mirror and seeing eyelids for a change. I haven't seen actual eyelids in years, and I can't wait until I can put some eye makeup on them. The rest of the sutures came out on day 13. It's day 13. I got all of the sutures out now. I have little steri strips right in the corners of my eyes. And by Friday evening, I should be able to wear some eyeshadow. It's 2 weeks and 1 set of hair extensions past the procedure. It looks like a lot of time has passed because my hair is longer, but that's the extensions. So it's really been 2 weeks now since the surgery. The surgeon was excellent. There were no bandages, no downtime. I recovered very quickly. Okay, this is 2.5 weeks after I had the eyelids done, and they are healed nicely, and I'm able to wear eyeshadow, which is very exciting. And they're still a little sore, a little tight, but nothing bad. And I'm gonna get up close so you can get a nice close look at them. How do you like my eyes, Tink? Huh? Do you like my eyes? Do you like my eyes? I think he needs a little eye lift. Let's take one more look at the before. Here I am with all that excess skin and tissue, and see how the skin is folded over right down to the lash line. And here I am after, no makeup, still very swollen. But here I am with makeup. The swelling will go down over time. I'm able to put the darker shadow in the crease, which I could never do before because that was under that excess skin. The swelling will go down over time. So if you're thinking of doing this, it was not that big a deal and it turned out really well.